Good morning, everyone. It is officially Give for Good Day. I hope that you are as excited as I am. I started the day out this morning at the Shreveport Aquarium. I was there with other local nonprofits who are also raising money today. KTBS was kind enough to host us with their first cup. So if you're not familiar, Give for Good is put on by the Community Foundation of North Louisiana, and it is the largest day of online giving for our community. This year, the Community Foundation has set a very ambitious goal to raise $2.5 million today. By about 6:30 this morning, we had already raised over $1 million. So I think our community is well on its way to hitting that goal. For MLK, we have a goal to raise $15,000 today. And right before we started filming, we were at a little over $13,000. So I am confident that our community will help us reach the goal. It's my hope that we can blow that goal out of the water today. So if you're interested in participating and supporting the work of MLK, please visit www.giveforgoodnla.org/MLK Health. So what we're gonna do today is I wanted to do a quick little virtual tour of MLK so you can see exactly where your funds are going. Throughout COVID, we weren't able to do tours, so I thought we could just bring it online today and give you a quick little tour around MLK. So come with me. We're gonna head over to our vital assessment area. So this is our patient's first stop of their visit. This is what we call our vitals assessment area. So this is where the patients get their blood pressure, their weight, their height, their glucose checks. So obviously we don't have clinic every single day. We have certain days of the month where we have clinic, and all of our providers volunteer their time. So we work with our providers based on their hospital schedules or their private practice schedules. But what is really cool about this space on clinic day is that we usually have a lot of med students with us. So we have a great relationship with the local med school, and it's really exciting to get to come alongside the future leaders of medicine and really help them gain a little bit more confidence when they're working with patients and learning how to do blood pressure checks and teaching them how to do finger sticks for glucose checks. So you don't really get the full experience today, but this is stop one on a patient's visit. We're going to come back and peek into some of our exam rooms. What you will notice is that every exam room is decorated differently. So art is a very big part of our model of health here at MLK. We don't believe that you have overall health apart from our physical spaces. So we wanted to create a warm, welcoming environment for our patients when they come for their visits. So this is exam room number 1. We have a really nice little mural going on. This was actually painted by our founder's daughter. Dr. Jackson is an avid duck hunter, and so his daughter wanted to do a nice little landscape scheme for him. And now we're going to come back to our medication education room. So this room is LSU, but this room is very, very important. So we do have the pharmacy on site, and so our patients get all of the medications that they need during their visit. But it's really important to us that before patients leave with their medicines, that they sit down with our pharmacy manager and actually walk through each one of their prescriptions. So we work with them to make sure that they understand what their medicine is for, how often they're supposed to take it, and how they're supposed to store it. So this is the space where Jennifer meets with our patients. We have this really nice little placemat here that we developed because we know some patients learn visually. So some patients are comfortable looking at the labels with Jennifer and walking through it, and at that point she can check off to make sure they understand. Sometimes patients just need to put all of their meds out on the table and group together saying, I know this is medication I take once a day, or this is the medication I take with my dinner, or I take it 3 times a day. So we really work hard to accommodate different learning styles when it comes to the medication education. So this room is really important. Stop. This here is our centenary room, and it's also our diabetes education room. There's a lot going on in here, but this is a spot for our newly diagnosed diabetics or uncontrolled diabetics. So those are patients who have an A1C greater than 9. So it's really important to us that our patients really understand what's happening in their bodies, that they understand how the choices they make with their food and their daily movement affects their glucose. And so this is where our clinic manager, Brenda, will sit down with them one-on-one and just, like I said, explain to them what diabetes is, what's happening to their body, and then give them some tools that they can take home with them to try to make healthier lifestyles that's going to help them live well with their diabetes. So this is our over-the-counter storage area. Right now we're kind of in a transition, but all of these products that we have here are provided to us through Direct Relief. So if you're not familiar, Direct Relief is an international emergency preparedness organization, and so they mobilize medical supplies in the events of natural disaster. So MLK partners with them because we are a host site for those emergency packs in the event of a natural disaster like a hurricane. But through that partnership, they gift us all of these over-the-counter items that we can then turn around and gift to our patients. So you'll see that, like I said, right now we're kind of low in stock, but we're expecting another shipment from Direct Relief soon. So we'll do a part 2 and you'll get to see our shelves all nice and stocked. But like I said, these items here are what we can gift to our patients just to make their loads a little bit lighter when they leave MLK. So we want to thank Direct Relief for their support. And now we're going to pop on into the pharmacy. So this is the MLK pharmacy. It is important that we have this on site so that when our patients come for their visit, they have their medications with them when they leave. We are the oldest free pharmacy in the state of Louisiana. Very proud of that. And we're fully stocked for all of the conditions that we treat. So we work with adults who have diabetes, asthma, high blood pressure, high cholesterol, COPD. So we are fully stocked for all of their maintenance meds. Most of our medications come from local nursing homes, so we partner with 35 nursing homes across Shreveport-Bossier. We can step in. I can show you real quick. So their medications come in these nice little bubble packs, so everything that we get donated has to be in date, cannot be expired. But what's cool about the nursing home packs is that every single one of them is individually wrapped, so we can guarantee that they've not been tampered with. Because we're a free pharmacy and we don't charge for our medications, we're not double dipping on the same prescription. So the patient at the nursing home didn't pay for these meds and then we turn around and charge our clients for it. So this is a very important partnership for our pharmacy to work with these nursing homes. Of course, we do have a pharmacy budget where we're able to purchase medications not collected through donations. And then we also help our patients with prescription assistance programs. So most pharmaceutical companies have a charitable component to their company where patients who qualify financially can apply for free medications directly from the pharmaceutical companies. And so we help our patients do that. But this is a quick little peek at the pharmacy. But like I said, the most important part is that it's on site, so our patients are not having to go to another location to get their prescriptions. So now we're gonna pop over to our lab. And again, what's important about our lab is that we have the lab on site. So, most of our patients that come, they might not have PTO to make medical appointments. So when they're coming, they have very little time off from work. So we want to make sure that when they're here, we can maximize their time. So when they come for an appointment at MLK, they get to see their provider, they get to have their annual labs drawn, they get their medications and that medication education. We have a dietitian on staff that can talk to them about nutrition and all things wellness. But this is the lab, so we have volunteer nurses that come and help us draw blood. We can do point of care testing, so like A1Cs, things like that. Our providers get that data in real time. We can do STD and HIV testing. And we can also test for Hep C. So MLK does not treat HIV, we do not treat Hep C, but we do have first doses. So if we do get a confirmatory test, our patients are able to walk out of here with their first dose of treatment, and then we refer it back to the state for them to open a case and manage that care. But it's really important that if we're diagnosing it and catching, those positive tests, that we're able to let patients walk out of here with treatment. So that's really cool to have the lab on site and then the pharmacy right next door, so they're getting those treatments. And then we have some more exam rooms. So these are all decorated differently, of course. We have another LSU room. We have a lot of LSU fans that are supportive of our work as well. So this is a mural that was painted by Co-Creative, the artist collection. They painted this for Gift for Good back in 2017. People often see this room and think it's our peds room, our pediatrics. But one thing I did not mention is that MLK, we serve adults only. And the reason we made that choice is so MLK is privately funded. We don't receive any state or federal dollars for the work that we do. So we have a very limited budget. And so we had to make the decision of who we serve so that those dollars can go as far as possible. In the state of Louisiana, most children will qualify for Medicaid even if their parents don't. So we do have families where parents are ineligible for Medicaid, but the children qualify. And so for that reason, we decided we were going to serve adults only, because they are the ones that can truly be left without a safety net. And of course, you have to have a saint's room. We're coming to the end of the tour, but I did want to stop off into our College of Nursing. We call it our cubby hole. So we do have a formal partnership with NSU College of Nursing. They're actually a couple blocks over. So for their graduate students, so registered nurses who are going on to become nurse practitioners, they actually get their clinical hours here. So we have NSU faculty that run a couple of clinics a month for us each month, and they bring their students with them who get their clinical hours. So on NSU run clinic days, this is always jam-packed with students and faculty, textbooks, all the fun stuff. So like I said, it's really fun for us to get to be partners with the future leaders of medicine. So it's really important to us, those partnerships with the medical schools that we have across Shreveport-Bossier. Upstairs are just administrative offices. I'm gonna pop in real quick. This is Mary Lou. She is our Latino health advocate. And she's just gonna say good morning. Good morning. And Miss Sue is on the phone. But if you, she's gonna turn around and say hello. So if you are out in our community and you need help, Miss Sue's gonna be the one that you call today. If you need any of our services, you can always give us a call at 318-227-2912 extension 3, and that'll put you right through to Sue. But we've come to the end of the tour. Like I said, I just wanted to be able to give you guys a quick little view so you can see exactly where your donations will go. So I hope that you learned a couple of things today, and I really hope that you'll head over to giveforgoodmla.org/MLK Health and support the work that we're doing. Hope you have a great day.